Hi there, welcome. We're just waiting for a few more people to come on and then we'll start in a minute. So I'm Dr. Christina Holmquist. It's nice to meet some of you for the first time. We've got a pretty small group here today, so if you have any questions, feel free to put up your hand during the presentation and I can answer those. Yeah, we'll be covering some generals for fertility tracking, so it can be applied for someone either looking to conceive or to avoid conceiving, but then I'll also be giving some things to consider if you're trying to get pregnant in the next a few years, few months, whatever your timeline is, because the main basis is fertility for the presentation. Yes, we're also recording this presentation, so it will be available afterwards if you wanted to go back and re-listen to it, and I can share the slides as well, so you'll have those. Yeah, I can't answer any personal medical questions in this setting, but if you have a general question, I can't tell you what to do in terms of treatment, but I can tell you these are some things you might want to consider. Yeah, that type of answer. So with that in mind, let's get started. Right, so you've all come here today to learn about fertility and cycle tracking, which I'm super excited to teach about. I think it's one of the areas that we don't get enough education about as a society and a culture. So I'm hoping to change that today for some of you, and hopefully you'll learn at least one thing that's really helpful. Yeah, I'd love to hear at the end of the presentation what you learned that was really helpful. So keep that in mind as we go along. In terms of my background, I'm a naturopathic doctor. I've been practicing for the last 4 years, and I have a special interest in female hormonal health, amongst other things. I have a pretty broad practice, but I've been tracking my own cycle for the past 12 years, and I've done training in both Billings and Creighton methods of fertility tracking. So had a lot of personal experience and also taught a lot of people how to use these skills for their own medical needs, which I think is great about the naturopathic way of looking at fertility in your cycle, because we're not just looking for fixing things when there's a crazy problem or when you're trying to get pregnant. We look years in advance to make sure things are healthy with your cycle and that you're having a there are no signs that something could be wrong. So we can find things out sooner and fix them in a more natural way if fertility is one of your goals. Yeah, so with that, let's get into things. So I have this chart here. This is a fertility chart in Canada from 1921 to 2022. Really interesting to see. There's a big drop in the 60s. I mean, we know there was a big boom in birth rates after the World Wars. But then we've seen it continue to drop even after that initial drop. So some of that was obviously related to choice, people wanting to have smaller families. But at this point, there are a lot of people that would like to have children that have difficulty conceiving. So that's kind of where we're getting into the 2011, you can kind of see things start to go down even further. So yeah. This is a general North American statistic taken from a fertility website, but 1 in 6 couples experience infertility. So pretty common. Most of you probably know someone who struggled with fertility. And then I just wanted to break down the statistics in terms of men versus women, because a lot of the time historically, the onus has been put on women to be it's their fault if there's infertility in the relationship. Whereas in the research that they're looking at now, they're finding that 30% of the time it's actually related to male factor infertility. 40% of the time women, so still slightly higher, but then 20% of the time it's a mix of female and male factors. And 10% of the time they can't find a cause. I think there's always a cause probably, but maybe we don't know enough, or it's more of a cause that affects fewer people, so we're not looking for it as well. Yeah. So in terms of fertility goals, if there are issues, it should be both the man and the woman who get assessed for causes. Especially if it's taking longer than 6 months. The standard for fertility is if it's taking longer than 6 months to conceive, there might be some issues. And they'll do, definitely if you're like over 35, they'll recommend testing from a medical standpoint if it's over 6 months. If you're under 35, under 30, they might say to wait about a year of trying before they do testing. But we can kind of tell earlier without even testing, just based on cycle tracking. So we'll look into that a little bit more. So here are some kind of things you might want to consider if you're looking to get pregnant in the next couple of years. Would be good to check your thyroid function. If your thyroid's not functioning well, then you might not be ovulating regularly. Or even if you do get pregnant, you could have a miscarriage if your thyroid's not able to support that, because there's a big metabolic demand on your thyroid to carry a pregnancy. Otherwise, metabolic health markers are important in terms of like blood sugar, cholesterol. Those can start to get kind of out of whack if you're overweight or if you're inactive. Also, the older you get, the more likely those things could be to be elevated. And it's important because having high blood sugar, even before you conceive, can damage the eggs that you're producing. So, and same with cholesterol, that causes inflammation in the ovaries, and the eggs quality can be lower, which could result in like increased chance of miscarriage or difficulty getting pregnant. Otherwise, iron and B12, those two nutrients are important for making red blood cells, and the red blood cells are needed to carry oxygen everywhere in your body, including to the future baby, right? So once you do get pregnant, your iron levels, if you're just borderline before you get pregnant, they can sometimes drop because your body makes a lot more blood. So you could have a lot of fatigue if you don't have enough iron. So it's good to prepare in advance to make sure you have enough of these nutrients before you try to get pregnant, so that you don't have like really low energy during the pregnancy. Vitamin D is important for immune system function. So sometimes with difficulty getting pregnant or frequent miscarriage, it could be that your immune system is overactive or underactive, and that could cause a miscarriage. So vitamin D level, making sure that's good, just good preventatively. It's not, I'd say, quite as important as some of the other things, but still I'd recommend checking that. And then otherwise, these are less key, the inflammatory markers. I'd say like if you have joint pain, like a history of autoimmune conditions, good to make sure that those are low. Or if you're having difficulty getting pregnant, I probably wouldn't run them across the board without a reason to. And then hormones. I'd like to check the post-ovulatory progesterone if people have symptoms that it could be low. Otherwise, I'm not necessarily concerned with it. But you need progesterone. Like the word itself means progestation, right? Gestation is pregnancy. So you need that progesterone to thicken the uterine lining after you ovulate, so that the egg has somewhere to go and implant, and the lining has to be healthy enough to support that egg until the placenta is developed to produce progesterone. So if you have low progesterone, it increases your risk of miscarriage. Also usually shows up as some sort of PMS symptoms. So, and there's some key indicators we can look for in cycle tracking that would tell us maybe we should check the progesterone. The FSH, I put this here, it's like a marker kind of menopause, or like of low level of egg availability, or PCOS. So good to check that one. I'd say especially if you're having difficulty conceiving, to make sure that there's no like premature ovarian failure or PCOS. I probably wouldn't check it just prophylactically, but if someone was having trouble, I might check that. Same with the other hormones, like we've got estrogen, testosterone, luteinizing hormone. Those are all key in fertility. But I don't necessarily check them unless someone's having trouble, because it's not going to cause a miscarriage if they're off, whereas the progesterone could. So we want to make sure that's in the right range. Yeah, Sarah's got a question here.
Yeah. So with someone who had thyroid issues, but like stable, yeah, like what challenges could they have?
Yeah, yeah. So the question was, if someone has thyroid issues, and it is stable.
Yeah, I guess it could be both cases.
Either way, yeah. Would it cause? What types of challenges would it cause? And it could cause like either miscarriage, recurrent miscarriage, or difficulty getting pregnant. If you're on medication for the thyroid and like you have a diagnosis, it's less likely to cause issues, but you could still, especially if it's an autoimmune thyroid condition, the autoimmune antibodies create inflammation just in your whole body. And so that inflammation can make it more difficult to have a pregnancy. Yeah. Yeah, you would probably know if you had a thyroid function issue. Usually hypothyroid is the more common one. And you might feel like cold, you might gain weight easily, have constipation, dry skin. Those are kind of some of the most common symptoms. So good to get that checked out if you have any of those. Here I've got a picture. This is like the average cycle. So 28 days is average for a cycle. It's not the only normal length of cycle. Normal cycle is anywhere from 24 to 34 days. And usually the period should last from 4 to 7 days to be healthy. You can see here there's like a window where conception is possible. Ovulation on this graph would happen at day 14. Now, again, day 14 is kind of like the average day of ovulation, but for different people, it happens at different times. And that's why cycle tracking can be helpful to pinpoint exactly when you are ovulating. Because oftentimes, if you're using like an app to predict when you're ovulating, it's just going to base it on like what the average time is. And your cycle could be quite different than what the average person's is. Not necessarily unhealthy, but just different. Yeah, so after ovulation, the egg will last for roughly 24 hours. So between day 14 and day 15 is kind of like, well, day 13 to day 15 in there is kind of the highest possibility of conceiving. And then day 16, really, you're only going to conceive if you have a second ovulation, which happens very occasionally. You could release an egg and then another egg the day after, but that's not very common. So usually day 16 is pretty low fertility on this graph. And again, it'll depend when you ovulate, when that day 16 would be for you. And then leading up to ovulation, if you have good quality cervical mucus, the sperm can survive for about 5 days in that, if they're healthy sperm. So it's kind of possible for about 6 days out of the month for conception to happen. Yeah, and then we see here the area in blue where the lining is thickening is the area where once the follicle ruptures, it releases progesterone, and that's your progesterone level should go up. And that's going to be responsible for the thickening of the lining. So if you don't get that progesterone release, you won't get that thickening of the lining, and you might even have a shorter, like the blue phase might be shorter in your cycle if you don't have enough progesterone. So when we're looking at tracking where we are in the cycle, there's a bunch of different biomarkers we can use to estimate pretty accurately where we are. BBT stands for basal body temperature. So that is the temperature first thing upon waking before you like move. You have to move minimally, take your temperature right away. And it's to like 2 decimal points. And so what happens with that is after you ovulate, your basal body temperature increases by like 0.5 to 0.8 degrees. So it's pretty minimal, but enough that like there's a significant change that we can track. So through tracking basal body temperature doesn't help you predict when you're going to ovulate, but after ovulation, it can confirm, yes, ovulation happened if your temperature rises as it should. Mucus, I'd say, is the most important thing because it can tell us the most information. So the quality of cervical mucus is important for the sperm to be able to survive to make it to the egg, but it's also an indicator of hormonal health. You need your estrogen level to rise appropriately for the mucus to be produced. So like good quality cervical mucus comes with like the rise in estrogen level. We'll go through some pictures of what that looks like, but it's maybe the one people are the least comfortable with tracking because it's not as objective, it's more qualitative. You have to learn to read that and become familiar with it, but it can also give you the most information about where you are in your cycle and what's happening with your hormones. Then this one's pretty popular, the LH or estrogen strips. A lot of people use the LH strips to predict when their ovulation is going to happen, because you get an LH surge right before you release the egg. So people will test their LH in like the first half of their cycle leading up to ovulation. And that's a urine test strip. Can be helpful if you're trying to like time intercourse. It can be like falsely positive if you have PCOS, because in PCOS your body tries to ovulate over and over again, but it doesn't actually ovulate. So it gets that like spike of your body trying to ovulate, but doesn't actually mean there's an ovulation. So it can have false positives. Even in someone who doesn't have PCOS, if you're like really stressed 1 month, maybe your body will like try to ovulate, but then not ovulate. So again, not 100% accurate, but something that might be helpful. Cervical position, I don't really teach this one, but I just mention it because your cervix does change position throughout your cycle. It's during ovulation, it's going to be like higher up in the cervical, in the vaginal canal, and then closer to your period, it will move lower down. So some people can use that like height difference to track kind of where they are in their cycle. And then we've got lots of different apps here. Most of these just rely on the other biomarkers I just mentioned. This app with the temperature, the water droplet sign here in the bottom left is called Temp Drop, and it's a basal body monitor you can wear on your underarm. It's helpful because you don't have to remember to like do the thermometer check in the morning when you first wake up, which can be hard to remember when you're just waking up. And it also is helpful because if you're waking up like throughout the night, that can make the temperature check less accurate. But this one monitors your temperature throughout the night, so you get more of like an average reading. So I like the Temp Drop personally. There's also the Mira, which is the top right-hand corner. This one measures LH and estrogen, which could be more accurate than just doing like the LH test strips. But these devices are a little bit more on the pricey side and not necessarily necessary, but nice to know about in case you're interested. Then I've got the rhythm method here. Like we talked about, that's like going based off that 28-day cycle, the kind of average. If you have like a 32-day cycle, it'll stretch the average days to like match the 32 days, but it's not going to tell you accurately when you're ovulating. It'll just tell you on average, like one with a 32-day cycle would ovulate around here. So not as accurate, but I'd say better than nothing if you're like not doing anything to track your fertility. Okay. Next we have, oh yeah, this is a great picture. This is different types of cervical mucus. Let me just make this full screen. Oops. I don't know how to. Yeah, I'm just going to leave it. So this is what we're looking at when we're looking at cervical mucus. The column on the right, you've got it clearly indicated, is the fertile quality mucus. So fertile quality mucus occurs usually like 1 to 2 days before ovulation and the day of ovulation, maybe the day after, but after that there should be like an abrupt stop in the fertile mucus, going back to dryness. So once that like shift happens, you can presume you've ovulated. It starts out more subtly though. So with the fertile mucus, you're looking for something that's like stretchy, slippery feeling. It might feel kind of wet. It could be clear. It could have a little bit of white, but it's usually more clear. And if you pick it up between your fingers, which I do recommend you do because it gives you more information, it should stretch like at least an inch. So you can stretch it between your fingers at least an inch. Yeah, and then leading up to before you get this like really fertile mucus, you might have more like kind of subfertile, maybe fertile types of mucus, especially like the creamy ones might be like creamy, stretchy, or like a little bit white, but also a little bit stretchy. And these can happen like between your period and ovulation. as your body kind of prepares and the estrogen slowly rises, because it's a gradual shift from like the low estrogen. Your estrogen's at its lowest at like day 3 of your period, and then it starts to rise from there. Now, in some people, it's possible to ovulate really early on in your cycle, in which case you could be fertile on your period. If your period, like your day 5 or day 6, if you've got a 7-day period and then you ovulate like 5 days later, you could be fertile on your period. Not super common, but I just mentioned that. Yeah, so ideally, if you're tracking your mucus for fertility, you would check every time you go to the washroom. You would wipe and feel the sensation across the peritoneum as you wipe from front to back. So you're looking for the feeling of dry, wet, or slippery. And then you would also look and see what's on the toilet paper, looking for the color. Is it white? Is it yellow? Is it like tacky or gummy? Sometimes it looks a little bit like gum that's like not fertile. As it starts to look more like sticky, slippery, stretchy, that's when you get into the fertile type, almost like an egg white consistency. And then you should also, if there is mucus there that there's enough of it, you should try to pick it up and see if it stretches if you're doing this for fertility tracking. And then you would kind of make a note at the end of the day or in your app as to like what was the predominant type of mucus that you experienced that day. So this is a picture of a Creighton style fertility charting. Now Creighton is the most intensive in terms of the rules for how to do it, but also the best for if there is any type of infertility concern, because it can pinpoint more as to what's happening, because it is so strict and so detail oriented with the observations that they teach you to make. So with these different patterns, you can see like this top row here, we've got a pretty normal like 6-day period. That's great. And then it goes into these green are just dry days. This is like no cervical mucus. And then this white here, it's got a little baby sticker, but that's potentially fertile quality mucus. But you can see they only get 1 day of that fertile quality mucus. And then these 3 here are like you do a countdown of 3 days after that before, if you're using this for prevention, you would be able to have sex without possibility of pregnancy. So that's what these are. These are not necessarily mucus days. So they've only got 1 day of like fertile quality mucus and then back to the dry. So that this person's not making enough cervical mucus. Maybe they have low estrogen. They're probably not ovulating. They could be ovulating, but just not having enough mucus to actually get pregnant. You need that mucus to take care of the sperm so you can get pregnant. So that's helpful to know. There's things we can do to work on that. And then this one, you can see here, this person had again, normal periods, some dry days. This is like more of a normal pattern. You've got some like fertile pattern type mucus, and then peak is this day here. They might have been able to get pregnant on this day, but then if the pregnancy didn't continue, I'm not sure why. You might not necessarily miscarry like this, but you might have a period earlier, or you might have a period like later than it's expected. That could be a miscarriage. And then here, this one I find is more common to see and good to know about. This person has a normal period, pretty normal like ovulation, but then before their period starts the next month, they've got several days of spotting. This is not like heavy bleeding. This is just like very, very light bleeding. The VL is very light. So spotting before the period can indicate that your progesterone is low, because you need that progesterone to keep the uterine lining thick. And when you don't have enough, the uterine lining starts to disintegrate before it should. So that's when you get kind of that spotting before your actual period starts. Last one here is just abnormal bleeding. This might be someone in perimenopause. This could be someone with like a fibroid or some sort of cyst that's not having a normal cycle. So that should be further investigated. This is a pretty information-heavy chart. Any questions so far at this point? Yeah, you've got a question.
Sorry, I
I'm
just
not
want to
sure.
unmute myself. With the low progesterone, right? What is the remedy for that if you have that? Because I noticed I have some spots before a period. I was like, oh, I must be low progesterone.
Yeah, you could be. Sometimes it happens with age. Like the older you get, the more like the harder your body has producing progesterone. So high stress could also trigger low progesterone because when your body's making cortisol, it takes from the same like the molecule needed to produce progesterone is the same one needed to produce cortisol. So if you're really stressed all the time, your body's going to make cortisol instead of progesterone. It'll switch that pathway. So stress is like a big contributor to low progesterone. And that stress could be like mental, emotional, it could be physical. If you're like doing high intensity exercise like 6 days a week and not eating enough, that's going to be a stress on your body. So identifying wherever those stressors are and working on that. Other causes, those are the most common ones, but like I said, nutritionally, if you don't have all the nutrients you need, you might have some of that low progesterone picture from poor nutrient intake. Yeah.
Is there like a vitamin like you can take? Like I've heard of like ashwagandha can help with pregnancy and stuff like that. Is there something I can take for low progesterone?
Yeah, we're going to get into
Oh,
treatments a little bit later
okay.
on, so we'll
Okay.
go back to that. Yeah.
Okay.
Okay, I wanted to show this one. This is a different method of charting. This is like called FEM, but it doesn't matter. Just as long as you can see kind of the blue is when someone has like wet discharge, wet cervical mucus, and the dark blue is when they have the fertile quality cervical mucus, the gray is dry days. So in PCOS, what happens is your body keeps trying to ovulate but isn't successful. And so here you can see they've got some like, oh, really fertile mucus, and then more dry days, and then some fertile mucus, and then some dry days. And it goes through that cycle over the course of the month. Also with PCOS, your cycles might be like longer or shorter than they should be. As you can see here, the cycle is like 51 days, right? So that's important to rule out PCOS if you have an irregular menstrual cycle. Yeah, that's kind of PCOS. And then, second, I see my notes. Oh, maybe I didn't include it. That's okay. All right. So methods of tracking, like I've already mentioned, we saw the Creighton chart, what that looks like. That one's the most intensive. It's a little bit expensive to learn because you have to do, I think, like 6 or 8 sessions with someone to train you in how to do it. It's pretty intense in terms of rule-based and like making sure you know what you're like seeing, but really useful if someone's experiencing infertility and especially like unexplained infertility because it can help pinpoint a cause. For that, I've got notes on like perfect use and typical use. This is for pregnancy prevention. So if you're using cycle tracking for pregnancy prevention, the Creighton is also the most effective for that with like perfect use of it. You have like 0.5 chances. This is in in a couple in a year of being sexually active with perfect use of Creighton. There's a 0.5% chance they could get pregnant, whereas typical use is 4%. And I've put just for comparison oral contraception, IUD, and condoms. So actually, Creighton is more effective than oral contraception and condoms, but slightly less effective than IUD. So it's like really effective when people say cycle tracking is not effective for pregnancy prevention. It is. You just have to be invested in like learning how to chart your cycle for it to be used for that. Yeah, and it is effective because we get really accurate data around when someone's ovulating. So you can use that data, like this is effective rates for preventing pregnancy, but you can use that data vice versa for like when is the most fertile time of the cycle for you, so you can have an increased risk of, or increased chance of getting pregnant. Here we've got Marquette. This one is based off of urine LH testing. So we talked about the LH test strips. You just pee on a stick. It'll tell you if you're LH, where it's at, if you're about to ovulate or not. Again, pretty effective for preventing pregnancy. It's helpful for that if someone is like in the postpartum phase and they don't want to use contraception, because it's more of a reliable biomarker. You don't have to look at mucus patterns for that. Billings is the other method. This is like a little bit of a looser version of Creighton. So if you're like just kind of exploring fertility tracking, I usually recommend like Billings is an easy way to start because you're looking at the mucus. It's basically what I showed you, but without all the rules of Creighton. So it's a little looser, more intuitive. And then we talked about the rhythm method too. This is just whatever, like if you have an app, it's going to tell you, oh, you're fertile here. That's the rhythm method. And again, it's like, it's better than nothing, but it's not going to be super accurate. And then there's a couple other, we've got symptothermal. There's other methods, but I'd say like the ones I usually recommend are Marquette, Billings, or Creighton. Okay. So nutrition for fertility. Actually, before we go here, maybe I'll just like check in. Is everyone comfortable with the fertility tracking portion of what we talked about? No questions there? Okay. That's great. We can always, if you think of a question, we can always go over it at the end. All right, so nutrition for fertility. I mean, much of this is pretty like logical in general. You want to limit your processed foods, especially anything rich in, I know I didn't write it here, but like sugars, right? Because that blood sugar regulation is important for fertility, but also just your overall health. Also limiting alcohol, deep fried foods. These can be inflammatory, and the higher the inflammation, the more chances of like genetic mutations and like egg or sperm development. It can be for both of the individuals in the relationship. And then I put fortified grains here because about 30 to 40% of the population has a genetic variation where they can't turn folate or folic acid into folate. And so fortified grains, they fortify them with folic acid. This was a public health intervention done to prevent spinal bifida from like not enough folic acid in the diet. But the problem with that is that the folic acid can actually make you more likely to miscarry if you have one of those genetic mutations where you don't process it properly. So especially if you don't know, I would say like limiting those could be useful, or if you're struggling with fertility and can't figure out why, maybe like limiting fortified grains, which is pretty much most of the grains. I think actually almost all. You can buy unfortified flour, but it's like more of an effort to find it. Yeah, I think people in general, you still need to get enough folate like in your diet, but we see here like leafy greens, they're a good source of iron, B12, but they're also a really good source of folate. So as long as people are eating enough vegetables, it's also in like liver, you should be fine on the folic acid and not need to get it from the grains. Yeah, otherwise, omega-3s are important for reducing inflammation, but also for fetal brain development. So we know that like there's been studies done to show that women who eat more fish or take like DHA or omega-3s orally, they end up having children with higher IQ. So it's needed. The oil, healthy anti-inflammatory oils are needed for brain development in the fetus. So good to get some of those in your diet for your health, but also for the pregnancy. And then I'm big on phosphatidylcholine. Like eggs are a good source of that. Again, because it's really helpful for fetal brain development and IQ. And there are certain genetic mutations where people don't use phosphatidylcholine well, and they might have fertility problems because of that. So it is important in getting pregnant too, not just in brain development, but you need good phosphatidylcholine for that. Eggs is the main source. You can get it in supplement form. But yeah, eat some eggs if you can. Oops. Oh yeah, then we talked about iron and B12 earlier on. The best sources are animal-based. There's actually no vegan-based B12 sources other than like nutritional yeast, and you have to take a ton of it. Otherwise, it's synthetic B12 to get your B12 if you're vegan. Iron, you can get it from a vegan diet, but it's just harder because it's not as absorbable in the plant-based form. Some people are fine, but if you are vegan vegetarian, like it would be really important to check your iron level before trying to get pregnant and make sure you're supplementing iron if you need more. Okay. So environmental factors, I like to briefly mention these and like discuss why it's important. I don't want everyone to be like paranoid about doing anything because these days it's pretty impossible to like avoid all these things consistently. You're going to be exposed to some extent in your environment. I think it's just about raising your own awareness of like your sources of exposure, and the impact. We have like pretty good evidence in the research that they are endocrine modulators, a lot of these chemicals I'm going to talk about, meaning they affect your hormone levels. And they can be really important for fertility, like not having an excess amount of these because they can skew your hormones and your ovulation. And yeah. So some of the main things I think that are like the heavy hitters that are easy to like control to some degree, making sure you're not cooking at home anyways on nonstick coated pans. The nonstick coating, like the Teflon, but other nonstick coating as well, have been shown to interfere with thyroid function. They also, like, once you take them in, it's really hard to get them out of your body. They're kind of, they stay in there a long time, and they can affect your other hormones as well. So I recommend doing like stainless steel cookware, cast iron cookware. Those are healthier to cook on. And it's like you pay for the investment of good cookware once, and then you don't have to think about it because you have it at home and that's what you use. So I recommend most people switch that. Otherwise, we're all getting more and more aware of plastics, microplastics. We know that they're finding like microplastics in the placenta and like in babies' blood. They're growing and growing in our environment and also in our bodies, the amount of plastic that we have in our bodies. And it does affect our hormone levels. Plastic is an endocrine disruptor. I'd say the main thing that like people don't think about is the lining in your coffee cup. If you're ordering takeout coffee, it's plastic. And when you put that hot water, hot beverage in there, that like melts some of the plastics and makes it more absorbable. So not ideal. Plastic water bottles, I think we've developed more of a cultural awareness around those. Again, also coffee pods, like everyone's switching to these fancy espresso machines, but they actually have a lot of microplastics in them. The pods are made out of plastic. Yeah, food containers, takeout containers, like making sure for sure you're not microwaving foods in plastic containers. And same with if you've got like plastic water bottles and you're not leaving them in the car on a hot summer day, like that's going to leach the plastic into the water bottle. But these are pretty hard to like avoid completely. I'd say like as best you can, minimizing them, like not buying an espresso or a Keurig if you have one already. If you don't have one already, or like bringing your own mug or making your own coffee at home so you're not getting the takeout coffee cups. Those changes are like easier to do in the long run. The odd one obviously is not going to be a huge deal, but I think if you're doing something every day, it's going to have an effect. Fragrances, yeah. Again, these are a big issue, and I think I just want to draw your attention to it. Not that we can perfectly avoid fragrances in our environment. You're going to go places, there will be fragrances. But as much as possible at home, using like fragrance-free laundry detergents, bathroom sprays, body wash, perfumes. If you need fragrances, like essential oils are a safer way to go. And yeah, again, these have lots of research showing they're endocrine disruptors. So we want to limit these as much as possible. And this one might be less controllable. I put this here just for like general information to like think about. If you're living near a golf course or a farm, you might be exposed to more pesticides. Those can have a negative impact on fertility and hormonal health, as well as like nervous system health, cognitive function as you age. Like there's a lot of I think long-term risks if you have a high pesticide exposure. Not to say you should like switch over to everything organic. That might not be affordable, but like if it is affordable for you, I would say probably worth thinking about switching over, especially some of the more heavily sprayed food items to organic. Mold, again, I just mentioned this, like it might not always be the most controllable. Maybe there's mold somewhere you live or work, but if you're having like long-term fertility struggles and you live in an environment that has mold, it would be worth like trying to get out of that environment, maybe doing some mold testing, because mold does stop your mitochondria from making energy, and you need the eggs that your body produces are one of the highest in mitochondria concentration. So if you're not making good energy in the mitochondria, the eggs are not going to be healthy, and they won't be able to like work as well. Also, just some things to consider. I personally think most people should be switching to a water distiller or like some other type of high quality water filtration system. A Berkey is a good option. Water distiller is the most affordable, good quality option. You could also do reverse osmosis. Things like a Brita, like it removes chlorine, and that's about it. And often the Brita filters will get mold in them, so you could actually be adding mold to your water with a Brita. So I don't usually recommend them because they don't remove enough from the water. If you're doing a distiller, like that, it boils and condenses the water over and over again, which removes most of the heavy metals, most of the radioactive elements, pharmaceutical medications. I was reading, I would have to look it up again to make sure this is correct, but I did a toxicology course maybe 6 years ago, and I was reading some research on the water filtration systems and what level of pharmaceuticals they remove. And I think it was in Hamilton, theirs was removing about 86% of the pharmaceuticals that were in the water supply. Now they're coming from like people's urine, right? We like pee into the lake, they take the lake water, filter that, and that's what we drink in the tap water. So they're removing 86%, which is like enough that no one's getting like overtly sick off of the pharmaceuticals, but there's a low dosage of like pharmaceutical medications in tap water that's like no system's completely removing them. So worth, I would say, just for that alone, to like get a water distiller and make your water better quality. You do want to, like the water distiller will remove all the minerals. So you do want to remineralize it with some like trace mineral drops, because your body will recognize and absorb the water better if it has some minerals in it. Like that's how water naturally comes, and your body recognizes that better. Yeah, so I've got some supplement ideas. These are kind of some of the most commonly prescribed fertility supplements. Like I mentioned, I can't make any actual supplement recommendations today. But like I'd say, if egg quality, if someone's older or they know there's an issue with their egg quality, then CoQ10, L-carnitine, and inositol might be worth looking into to support egg quality. Vitamin D, like I mentioned, it's immune balancing. If anyone has an autoimmune condition they're looking to get pregnant, it's really important to make sure their vitamin D level is at the optimum level. So we can test that with blood work and then supplement to the right amount. Prenatal could be really helpful for the nutrients to make sure that you have enough energy and feel good throughout the pregnancy. You want one with a methylfolate. Like I mentioned, some people can't convert very well between the folic acid and the methylfolate. So looking on the label to make sure that it's in the proper form is really important. A lot of them are not. A lot of the cheap ones are not the the right form because it's cheaper and easier for the companies to make it without that, and people don't know. And then iodine and selenium are also really important for thyroid health and important for, like, when you do get pregnant, your thyroid has to up its work by a lot. So giving it the nutrients it needs to be able to do that is important. So the iodine and selenium, having those in the prenatal. The other B vitamins, iron, those might be in a prenatal as well and are helpful just for overall like energy and red blood cell production. Yeah, I'd say there's other helpful things in a prenatal, but like those are the main nutrients you want to look for, like a good amount of those ones. And then I do use homeopathy sometimes for if someone doesn't have like the good quality cervical mucus, if we go through and they're not making enough or it's not long enough, we can use, especially folliculinum, it's a really nice homeopathic medicine for regulating the cycle, but also for producing good quality cervical mucus. And then there's many different ones, but it would have to be individualized based on which symptoms a person has. I just touch on the folate and folic acid debate again. Yeah, acupuncture. So as you know, we're an acupuncture clinic here. We do offer acupuncture, and it does have good benefits for fertility if you're trying to get pregnant. Also for stress reduction. So I'd imagine someone with lower progesterone could benefit from the acupuncture helping with that. But yeah, that would be individualized based on whatever your symptoms are. And then got some resources. I know I didn't directly answer the progesterone question. If someone had low progesterone, just to answer your question, I would typically do more of a herbal approach. There's some herbs that can increase progesterone levels. Wild yam is one of the most well-known, well-used ones. Vitex potentially. But I'm not going to recommend those like across the board because herbs have side effects and you need to know if they're safe to take for you and what the dosage is for you and your goals. But there are, like, in general, progesterone support formulas that would have some of those herbs, plus maybe some nutrients in them. So things like magnesium is important just for the stress reduction, but then that stress reduction goes into like your body producing enough progesterone. And ashwagandha potentially could like lower that cortisol, which would then help increase the progesterone. So there's lots of different smaller nutrients, even the B vitamins, like taking a general prenatal if you have low progesterone and are looking to get pregnant, then nutrients in that would support progesterone production. I've included some resources on this last page. These are some of my favorite things, like go-to for fertility support. So it's a great book by Toni Weschler called Taking Charge of Your Fertility. She goes in depth about the charting we discussed in this, maybe with some more information, lots of charts and graphs and things to help you like learn how to chart your cycle if you're interested in learning more about that. Nourishing Traditions is a cookbook, and I really love it because it focuses on like nourishing foods, but also like there's a lot of education as to like food quality and how to properly prepare foods. It's based on more like traditional patterns of eating. It requires a lot more food preparation, but there's some things that are easy enough to add in that would be beneficial in that book. And then in terms of the like hormone health overall, like I use a lot of the NAPRO, which is it's an organization based in the States, the US, and they use Creighton charting to then do hormonal testing and other things and potentially prescribe bioidentical hormones. So I do prescribe bioidentical progesterone for people that need extra progesterone support if the diet and the supplements aren't cutting it. But they've got some like information on progesterone on their website that's really interesting and helpful for all the many benefits of having enough progesterone. I've included these two websites below. The Marquette is if you wanted to learn like Marquette cycle charting. It's around $200 to $300 to like learn how to track your cycle with Marquette, which could be useful for like trying to achieve or avoid pregnancy. And then it has follow-up supported with like an OHIP covered medical doctor in Ontario. So if you're living in Ontario, you can learn. You have to pay to learn, but then you get follow-ups where like a a medical doctor can help you look at your chart and like decide what's going on based on that, which is really great. Same with Fertility Care Toronto. I'd say they have like slightly even like better help for if infertility is a concern. You would have to, I think the course to do Creighton is around $800 to $900. So like intensive program. But then once you have that, you would get a referral to, again, a medical doctor covered under OHIP in Toronto. And they would do intensive fertility testing that would be covered under OHIP and also use your charts to help you navigate your cycle. So they're a really great resource. Again, it's a little pricier, but if someone wants to go with more of a natural way to work on their fertility versus like an IVF clinic, they have really good success rates with the Creighton and NaPro, and it's less invasive and ends up like you might pay a little more initially if like you don't get the first step covered, but if you ended up paying for like a couple rounds of IVF, it would be way more expensive than going with the fertility care.